So, just for a second, picture it. What's the first thing that pops into your head when you hear the words heart attack? Is it someone grabbing their chest, falling to the floor? Because I've got to tell you, for so many people, that image is dangerously wrong.
Yeah, the reality is often way quieter, way more confusing, and unfortunately, so much easier to just ignore. And understanding that difference, well, it's everything. So let's start with that stereotype we all know so well.
We call this the Hollywood heart attack. You know the one, the dramatic, chest-clutching collapse. And look, severe chest pain is definitely a real symptom, but relying only on that image is dangerously incomplete. It can cause people to wait, to second guess, and that delay can be fatal, all because what they're feeling doesn't match what they've seen on screen.
And a huge piece of this puzzle, maybe the most important piece, is understanding how differently men and women can experience a heart attack. The symptoms often are not the same at all, and knowing those differences it's absolutely critical.
Okay, so check this out. Data from a study on heart attacks shows some really fascinating differences. When it comes to the pain, women are more likely to describe it as a squeezing and tightness. Men, on the other hand, also report a burning or even a pricking feeling. And get this, even the time of day is different. For women, it's more likely to happen in the morning, between 6 a.m. and noon. For men, the middle of the night.
And you can see why this matters so much, right? That burning sensation men feel, it's so easy to mistake that for simple heartburn. For women, that squeezing might not feel like the sharp stabbing pain they assume a heart attack is. These subtle differences in sensation are a huge reason why these life-threatening symptoms get brushed aside.
Now get ready for this number because it's absolutely staggering. The same study found that about 85% of women had what doctors call atypical symptoms of a heart attack. 85%! That means for the vast majority of women, the so-called typical Hollywood heart attack is actually the rare exception.
So what are these atypical symptoms? Well, they're things we'd probably blame on the flu or stress or just a really bad day. Things like dizziness, suddenly breaking out in a sweat, feeling short of breath, vomiting, intense back pain, and just this profound, crushing fatigue. These are not the big, dramatic signs we've been told to look for, but they are absolutely critical warning signals.
But it gets even trickier. Because beyond the symptoms during the actual attack, our bodies often send out even more subtle clues. And these aren't sudden. They can show up for days or even weeks beforehand. They're called prodromal symptoms.
Think of these as the whispers before the scream. We're talking about an unusual, overwhelming fatigue. Not just feeling tired, but feeling totally wiped out after doing something simple. Maybe some chest discomfort that comes and then goes away. Suddenly getting out of breath doing something you do every day without a problem. Even just this vague sense of not feeling right, or for some people, a real feeling of impending doom.
And this quote from the Cleveland Clinic just nails it. The danger with these early signs is that they're fleeting. They come and go, so it's incredibly easy to brush them off. You think, oh, it must be indigestion, or I just slept funny. But these little episodes, these waxing and waning symptoms, they could be your heart's last-ditch effort to get your attention before a full-blown emergency.
All right, we have to pause and clear up something that is super common and dangerously confusing. A heart attack is not the same thing as a cardiac arrest. They are two different things, and knowing why is key to understanding how to respond.
Okay, here's the simplest way to think about it. A heart attack is a circulation problem. It's like a plumbing issue in your house. A blocked artery is stopping blood from getting to the heart muscle. Critically, during a heart attack, the person is usually awake because their heart is still beating. Now, cardiac arrest, that's an electrical problem. The heart's whole electrical system goes haywire and it just stops beating. The person collapses, loses consciousness, and has no pulse.
And here is the absolutely critical link between the two. A heart attack, that plumbing problem, can seriously increase the risk of and can directly lead to sudden cardiac arrest. The damage from the blockage can trigger the fatal electrical problem. And that is exactly why you cannot wait and see when you have heart attack symptoms. Every single second matters.
So, knowing all this, what do you actually do in the moment? Whether it's for you or for someone you're with, having a simple, clear action plan can literally be the difference between life and death.
This is it, the single most important thing you can do. Don't try to drive to the hospital. Don't call your doctor's office first. Don't wait 5 minutes to see if it goes away. You call 911 immediately. Even if you're wrong, it is always, always better to be safe.
So, here's the plan. Step 1, you've called 911. Stay on the line with them.
Why? Because paramedics can start life-saving treatment the second they arrive, which can be up to an hour sooner than if you drove yourself. Step 2, if the person becomes unresponsive and has no pulse, that's cardiac arrest. Shout for help. And Step 3, begin CPR right away. You don't have to be a pro. Hands-only CPR can double or even triple a person's chance of survival. You are their lifeline until help gets there.
So we're going to end with this. After everything we've talked about, the subtle signs, the way it's different for men and women, those early warnings, the most important thing you can take away from this is just to listen, to pay attention to those quiet whispers from your body before they're forced to become a scream. So ask yourself, is your body trying to tell you something? Please, don't ignore it.